Hello viewers, today we are going to talk healthy talk show with Mr. Sanjaya Mariwala, and rather I can say Sanjaya Marigold. We will know about the marigold advantage and nutrients in our chat. So let's start with his journey in OmniActive as a marigold research product. Please take through the journey.
So many years ago, we looked at an opportunity in the healthcare space, and we decided to venture into it, deciding that the natural products are going to be extremely valuable sources for healthy, nutritious ingredients that can add value to human medicine and what we call preventive healthcare. Okay. In that, we came up with marigold as one of the key sources of a very interesting ingredient called lutein, which exists in all human eyes, and most humans need supplementation of this ingredient to protect their eyes from UV damage. UV damage comes to us from various sources. The UV rays in the sun, the UV damage comes from blue light, which is day-to-day use of cell phones, day-to-day use of iPads and computer screens and television screens. And the amount of time we now spend in front of these screens is so much that UV damage is a certainty, which is why you need to protect our eyes from the UV damage and increase the lutein concentration, which is where the concentrated lutein gives you the ability to supplement your diets with our lutein and ensure that you get protection from UV rays in your eyes.
So how the idea came to research on marigold and lutein?
So what we do is a very, an interesting technique. When we decided that we are going to be natural products for healthcare, for healthcare, and we say which are the segments that are fastest growing in the world, which have the opportunity for us to position ourselves. Against that, which are the which are the raw materials that have the maximum activity in that active level, which actives do they have that can contribute to making that product meaningful. From there we screen out products from 5 or 6 different sources and pick the one that is giving the best and the most economic extraction advantage. That is how we picked lutein.
That's great. So, as Executive Chairman and Managing Director of OmniActive Health Technologies, you have played pivotal role in building sustainable brands. So, could you highlight a specific success story of this?
So let's look at what we have done with, India has always been known for the pharmaceutical industry that India has built up. Okay, the Indian pharma industry does, generic medicines largely and offers it cheap to the world and cost effectively. What we did is something quite different. We actually created a whole preventive healthcare space entry with branded ingredients and IP protected ingredients, which are new patents that we have created in this space. And what we did is we sold this to the world with a arrangement that our customers will put our logo on their packs. Okay. We were one of the first companies in India to do this, and that is continued to expand. And today, every customer we sell to, we sell with our logo on their packs. So India is out there in the world saying Made in India is actually being visible across the whole world.
So as you said, India is the pharmacy capital of the world, and you are going to take this initiative to make a nutraceutical capital of the world in the future.
That's right.
So my best wishes with you. So your involvement in various industry associations and committees, and you have raised various voices for the government to make the herbal and nutraceutical on the global forefront. So could you discuss some of the key initiatives you have been a part of their impact and this impact?
So we have looked at various initiatives. One is we talked about the PLI scheme with the government. We have asked the government to put a PLI scheme in place for the industry. we are rationalizing the harmonized system of tariffs for the HSN codes have to be fitted for our products. Nutraceutical department has to be created within the ministry, in one of the ministries in the government, so that we get the momentum build up. And the whole idea here is to also invest in cultivated crops. Thereby, the medicinal plants that are getting extinct in the country are restored and rejuvenated, and we have the industry taking responsibility for growing these plants and cultivating making new sources available for plants. Thereby, the plants don't become extinct anymore.
With a background in multiple industry over last 30 years of your experience, set the nutraceutical space a part of your favorite. How do you foresee future growth and potential challenging in this industry?
I believe that India can be a very interesting source of these products, and I think what is happening is the world is starting to realize that they should not be dependent on only one or two sources of supply, which is diversifying the sources is becoming a huge requirement across the world, especially if you look at countries like US who are highly dependent on China. In view of the current geopolitical equations that are getting found, I think China plus one strategy everybody is following. This is going to create a very good and interesting opportunity for India to participate, because India is the only other country that has agroclimatic zones that are possible, in which we can grow so many different crops and create a competitive advantage for our exports.
Do you have any future planning to research any other crops for this?
For sure. See, marigold is not the only crop we do.
Yeah.
We do many other crops. We do crops for energy like ginger, blue ginger from Thailand, galangal, that is used in Thai cooking. We use that for energy purposes. Valerian is a sleep-driven root. We are exploring that. We are exploring Salacia reticulata, which is a sugar management solution. We do paprika, we do chilies, we do turmeric, we do a wide range of products, and those products are all agriculture driven.
How can we prevent healthcare or nutraceutical be integrated into the education curriculum?
I think it's important to make it a 6-month, course with which doctors should take as a part of their MBBS and MD courses. If we can, the system can make that mandatory as a curriculum, I think it will be very useful. I'm sure we can.
As Medgate Today is working very closely to the policy advocacy and with Niti Aayog and Health Ministry. So what you want from the government side that we can raise voice on part of India?
I think one single thing we want a Department of Nutrition established in some way. Once we have that, we can use that to get whatever points of access to the government.
In recent days, I have seen there was no medical device sector in the government. Pharma was taking care of medical devices. And the association has raised the voice against that, and now new medical device bill came and well accepted. So this required huge noise and huge voice to the industry, to the government. Then only they can.
I believe so. That's what is necessary. That's why I'm making so much noise, and you see me in the press all the time. I keep talking about this because I think this noise is the only thing that will get us this access.
So my best wishes with you, and I will advise you to do the more conferences and invite the government body, advocacy body to your conference, and take the other industry players on the same platform.
I agree.
So
thank you so much. It's a good suggestion to make. Yeah.
So take all the stakeholders on same platform.
Yes, I agree.
Thank you so much for talking to the Medgate Today TV.
Thank you for being here today. We appreciate this interaction. Thank you.